In the long axis view, the ultrasound probe is parallel with the long axis of the patient's body, and the ultrasound beam is looking lengthwise down. In some of these examples, we are not using an ultrasound probe cover, so it is easier to appreciate what we are doing. You will begin the long axis approach by first identifying the vein. You can slide the probe up and down to see where the vein is the largest. Next, you will rotate the ultrasound probe 90 degrees to find the ultrasound image of the long axis. Here is the correct ultrasound image of the vein in the long axis view. Once you have the correct ultrasound image of the long axis, you need to verify what is vein and what is artery. If you push the ultrasound probe down, the vein will easily compress, and if you tilt the probe more medially, you can see the artery pulsating. As you can see, the two vessels are very close together, which is why it is very important to verify where you are. For an in-plane technique, your needle is going to come in from behind the probe in the midline. Then you are going to find your needle. It is imperative that you try to keep the needle tip in view the entire time during needle advancement. Here we are advancing the needle in, looking at the needle tip, and advancing until we hit the vessel. This technique requires a higher degree of skill because little movements of the probe or the needle will disrupt the image. The key to these techniques is to see the needle advancing on the ultrasound image when you are physically moving the needle. When the needle is not moving on the ultrasound image, but you are physically moving the needle, you are most likely looking at some part of the shaft of the needle rather than the needle tip. To further illustrate, here you can see the physical needle moving quite a bit, but it is not shown on the ultrasound image. Therefore, you are looking at the shaft of the needle. In contrast, here we are physically moving the needle in and out of the vessel, and you can see that the ultrasound image mimics this movement. Therefore, we know we are looking at the needle tip.